the western half of our fine county. You know, I think Executive Ailman covered most of what I had to say. I did want to, he alluded to a meeting that he and I had at SSM in Lake St. Louis on Friday. Yes, we toured the emergency room and some other departments and met some really very dedicated people who are sacrificing a lot to deal with this pandemic. But we also met with Commander Garza of the St. Louis Regional Task Force. You see him a lot in the news these days, and Laura Kaiser, the CEO of SSM Health System. And I have to say that I believe Steve and I both went to that meeting hoping to see how we could all work together to move forward, move together as a region in fighting this pandemic and relieving human suffering. And I was disappointed that Commander Garza and Ms. Kaiser just wanted to talk about nothing else but mask mandates. They didn't want to talk about the studies surrounding mask efficacy, and despite the fact that masks seem to be a holy grail for some people in this so-called public health community, the data are very conflicting and honestly not all that good. I believe in masks, I wear masks, we wear them at my medical office, but honestly, I'm doing it more on a hunch that they might do some good than this religious-like faith that you see in masks, and certainly they're not the whole solution. You know, Commander Garza, Ms. Kaiser, again, we're just hammered on hospital capacity. According to the task force, this evening, I heard this on KMOX on the way home from work tonight, hospitals in our region are at 77% of capacity, ICUs are at 89% capacity. You know, I have to say, and that's serious, I take that very seriously, but I want to read you some headlines from 2018. Cover of Time magazine, hospitals overwhelmed by flu patients are being treated in tents. The Rochester, New York newspaper, hospital overcrowding, flu worsens effects of hospital crowding. California hospitals face a war zone of flu patients are setting up tents to treat them, and so on. And at the same time, Ms. Kaiser admitted that SSM was still doing profitable elective procedures, even though she was predicting imminent overwhelming capacity. More disturbing, Executive Ailman, working with our health department here in St. Charles, probably suggested no fewer than a dozen possible things that we could do as a county, as a region, to fight this pandemic and treat patients. And Garza and Kaiser just shot down everyone. No, that won't work, you need a mask mandate. That won't work, you need a mask mandate. I was really disappointed. And this Commander Garza, who lives in Ladue, St. Louis County, he lives in a county that has twice the death rate from COVID-19 as ours. A higher hospitalization for COVID-19 than ours. He could not tell us whether that he could give us no empiric data that people wear masks anymore in St. Louis County than St. Charles. He could give us no data about enforcement. Just know you gotta do it. It became pretty clear to me that I was dealing not with a medical scientist, but with an ideologue who had one idea in his mind and was not willing to talk about anything else. Hey, the real question is, do we believe in personal responsibility? Do we believe in the leadership that you and I and Executive Ailman exert to get people to do the right and responsible thing, or do we believe in government coercion? And I honestly think that that's where I differ from Commander Garza and County Executive Sam Page. How are we going to get through this? At the end of the day, this is a virus. I would suggest to you one reason we're having a few more cases in St. Louis County now than St. Louis County is because a few months ago, St. Louis County had a lot more viruses spread. It's what viruses do. Yes, wear masks. Yes, social distance. Yes, stay home if you're sick. But at the end of the day, this one-size-fits-all, one-trick pony approach that Commander Garza seems to be pushing on St. Charles County, I don't think is the right one. What's going to really get us through it? Operation Warp Speed, we're going to have tens of millions of vaccines available in this country within a few short months, maybe by the end of the year. So I thank you all for your time. I just want to commend Executive Allen and all of you for staying the course and, again, going along with what I think is the right approach, the approach Governor Parson has urged, and the approach that I believe is consistent with our values here in St. Charles County. Thank you.
Mr. Chairman, I have a question for the doctor.